Hence why it's important for us to, do the work within so that we're able to heal and experience vitality, longevity, and just optimal health while we navigate this experience that is very temporary. But I'm also a firm advocate that God did not send us here to suffer. We're not here to suffer. We all deserve to be well. God's intentions for us are to be well. Right? What's going on, Inner Wealth Champions? You're checked in with Amir Nazir, and welcome back. Of course, before we get started with today's video, family, as always, I wish you all inner wealth, which we know is the overall state of our holistic health, family. So today's video, family, is about how childhood trauma leads to chronic disease development. This, I would say, is often overlooked in the conversations around chronic disease development. There is a direct correlation between adverse childhood experiences and chronic disease development. And so without wasting time, let's go ahead and get started with the video. So first, family and Inner Wealth Champions, I'm going to start with the definition of adverse childhood experiences. So according to the CDC, which is the Center for Disease Control, it defines adverse childhood experiences, also referred to as ACEs for short, as potentially traumatic experiences that may occur in a child's life between the ages from birth to age 17. And so these adverse childhood experiences are usually categorized into three groups, and those three groups are abuse, neglect, and then household challenges. And then each of these groups have their own, array of subcategories as well, which reflect many adverse childhood experiences that many people may have gone through, and myself included, right? And so usually there are a plethora of signs that indicate an individual has experienced adverse childhood experiences. Some of these signs may include, a fear of other people, difficulty showing affection, difficulty learning in school, bedwetting, difficulty sleeping or having frequent nightmares, family. Other signs may include changes in mood, and then avoiding situations or events that reminds the individual of his or her traumatic experience. And so I do want to offer a few examples as well. One example, let's think about poverty, right? So let's say a person grew up in poverty. This is definitely an example of an adverse childhood experience. More often than not, an individual who grew up in poverty will have limited access to health care and nutrition, and due to that limited access, this individual has a higher risk of developing a chronic disease due to his or her lack and limited access to health care, access, and nutrition, right? And so without sufficient access to healthcare options and access to high quality foods, an individual's health is automatically compromised, unfortunately. Another example that comes to mind is, let's say, a person who's witnessed domestic violence. So with this experience, the individual has a higher risk of developing not only anxiety disorder, but then cardiovascular disease as well. So that's another example of how an adverse childhood experience, such as an individual witnessing domestic violence, influences his or her risk of developing chronic disease later on in life. Lastly, family, another example I wanted to hone in on is related to an individual's lack of social emotional learning, right? Lack of emotional intelligence growing up. So let's say a person, they did not receive sufficient access to social emotional learning, which again also relates to this individual not learning or developing emotional intelligence. And then relating that to food or nutrition, now this person, due to their lack of social emotional learning and lack of emotional intelligence, they, let's say, have developed emotional disturbance and symptoms associated with that. And one of those symptoms being emotional eating, right? Due to this individual's cycle of emotional eating, this individual can develop a risk for obesity or malnutrition dependent on his or her reaction to how they engage in emotional eating, right? And so that's just another example of how an adverse childhood experience related to emotional disturbance that's rooted in lack of emotional intelligence and, access to social emotional learning opportunities and resources can then affect an individual's relationship with food, which then increases his or her risk of developing a chronic disease as a result of their adverse childhood experience, right? And so, again, family, this wasn't intended to be a long video, but I did want to emphasize the importance of understanding how adverse childhood experiences have a direct correlation with chronic disease development later on in adulthood. And it's important to do the inner work. So this relates to why I'm a strong and I'm a firm advocate for inner wealth wellness, because once we pull back the layers of trauma, the layers of, any negative experience we may have had, anything that is outside of us that is not reflective of who we truly are on the inside and what we truly possess on the inside, as we pull back those layers, we're able to connect the dots between our experiences, our life outcomes, life trajectories, present moment in life, and we're able to understand how different traumas or experiences may have affected our current behaviors or previous behaviors that we may have overcame, right? So it's just important to do the inner work, because once we do the inner work and look within, we're able to understand our lives in hindsight. And then once we understand our lives in hindsight and understand ourselves from a holistic view and perspective, we're able to create events, we're able to create spaces, and we're able to use our creative intelligence that God has given us to then navigate this experience in a more healthy way to sustain optimal health, right? Because once we can pinpoint our traumas, pinpoint our triggers, we're able to truly embark on a healing journey that starts within. And that's all it takes, is for us to start within, to heal within, to go within, to focus within, focus on God, and we're able to free ourselves from this matrix, free ourselves from ourselves, and free ourselves from our past. And so, again, can't emphasize enough the importance of understanding how adverse childhood experiences impact our risk of developing chronic diseases later on in adulthood. And hence why it's important for us to, do the work within, so that we're able to heal and experience vitality, longevity, and just optimal health while we navigate this experience that is very temporary. But I'm also a firm advocate that God did not send us here to suffer. We're not here to suffer. We all deserve to be well. God's intentions for us are to be well, right? And so if we're not well, how can we navigate this experience to the best of our ability? We experience optimal health, right? And so again, family, I appreciate you all for tuning in with me, and I look forward to conversing with you all again in the next video. But before I let you all go, wherever you are, I trust that you're in optimal health. I trust that you're well. I pray and wish nothing less than optimal health, healing, and well-being upon you and your loved ones, right? And so until next time, family, I wish you all inner wealth, which we know is the overall state of our holistic health. Peace.